I'm 52 years old. My name is Jill, and I had facial plastic surgery with Dr. Lamb. The things that I had done were underneath my eyes. I was unhappy with the loss of elasticity and kind of the drooping and wrinkles underneath both eye areas. A little bit of sagging in the upper eye, so we had some fat injected here. I believe Dr. Lamb did fat injections here. I've recently lost weight, and so I had some sagging in the skin and just from aging. And then underneath my neck, I had a chin implant and had this tightened and had a facelift done. So this is day 2. I'm 48 hours in and pretty happy with the results. Some bruising and swelling. I bruise really easily, so I'm happy with the bruising that I have. It's minimal compared to what I thought it was going to be, and I'm up and about today and feeling pretty good. This is day 3 after my surgery. My swelling has gone down quite a bit. My lips are still small, and it's still a little bit difficult for me to open my mouth. But I can start to see some of the results. I'll be glad when my chin goes down a bit more and under my neck, so I can see what that's going to look like. My pain level has been extremely manageable with the medications that Dr. Lamb prescribed. So overall, I'm really happy for this to be day 3 after surgery. I had under my eyes, had some fat injections in my eyelids, Blepharoplasty on the bottom, some fat injections around my smile lines, and then I had a facelift and under my chin done, and a chin implant. So I had quite a lot of work to be that was done, and I think I look pretty good to have just come out of surgery 3 days ago. So we'll see what my results are tomorrow on day 4. Day 4 of my recovery from plastic surgery with Dr. Lamb. Once again, I had fat injected upper eyelids, under eyes. I had laser surgery, fat injections here, chin implant, and had, see if I can get to kind of the side of my neck. I had underneath my neck done. So I haven't had to take any pain medication today, so that's good. I'm feeling a lot better. Swelling is much better, and I found that putting an apple in the microwave with a little bit of water and honey on it, soften the apple really soft, and then eat that, and that will help if you have post-surgery constipation. So that is a tip that really helped. And I thought that might be useful for someone else going through the surgery. Jill Edelman, 52 years old, once again, day 4. Have a follow-up note. One thing that I have found that's really been helpful for me is I have a few friends that are surgical nurses, and so they made a daily chart, and they summarized the surgical instructions for the different procedures that I had done, and they have a log. So anyone who was here helping me, and then just for myself, to help me to keep up with when my meds were due and when creams were due and what I was supposed to be doing, we have a log where we log the time and the medication that was given. So it was pretty easy chart to follow, but I found that to be really helpful. And so if you're considering having surgery, definitely leave clear instructions for anyone who's going to be helping to take care of you, and the medication log is certainly very helpful. Jill Edelman, I am 52 years old. I had surgery 7 days ago with Dr. Lamb. Under my eyes, I had fat injections above the eyes around here, and I had a facelift, and then I had underneath my chin lifted, so I have stitches here and around my ears. As you'll see, I have a little bit of the bruising under here covered up. That's the only bruising I have left. Swelling around here and under my neck, maybe behind my ears and on my ears a little bit. Other than that, my swelling has really gone down. So for week 1, I am extremely pleased. I've been in a minimal amount of pain, didn't have to take my hydrocodone for the full 7 days. And it's really been easy. Recovery's been easy. I've walked around the block, and I've been pretty active, not driving, but I go to have my stitches taken out today. And so if you're thinking about having surgery with Dr. Lamb, I would highly, highly suggest it. Don't wait. Get it scheduled now.